Did you know that a common fruit found in most kitchens across America is silently contributing to thousands of hospitalizations and even deaths among seniors over 70? While many consider this fruit harmless or even beneficial, shocking new research reveals it can trigger devastating health complications in older adults when their bodies can no longer process certain compounds within it. The issue is that by the time people begin noticing symptoms, the damage has often progressed significantly, leaving them with limited options for recovery. But by becoming aware of this risk early, you can take meaningful action to protect yourself or your loved ones and potentially add years, maybe even decades, to life. In this video, we're going to reveal why this popular fruit becomes dangerous after 70, the 5 serious complications it can cause in aging bodies, and most importantly, what safer alternatives provide the same nutritional benefits without the risks. These aren't just abstract warnings or dry statistics, they reflect real people, families, and decisions that can make the difference between a life burdened by preventable illness or one filled with strength and vitality. Stick around until the end, because what you learn today could shape your ability to stay active, self-reliant, and healthy for years to come. Let's dive into the surprising truth about this common fruit and why it poses such significant risks after age 70. The hidden danger: grapefruit after 70. Grapefruit, that juicy, tangy fruit many people enjoy with breakfast or as a healthy snack, is actually one of the most dangerous foods for adults over 70. This might sound shocking since grapefruit is often promoted as a nutritional powerhouse. It's rich in vitamin C, contains beneficial antioxidants, and has been recommended for weight loss and heart health for decades. However, what makes grapefruit beneficial for younger adults is precisely what makes it dangerous for seniors: its potent biological compounds. Specifically, grapefruit contains substances called furanocoumarins and flavonoids that dramatically interfere with how the body processes medications. This isn't just a minor interaction, it's a serious medical concern that researchers have linked to thousands of emergency hospitalizations annually. The danger lies in the fact that as we age, our bodies process both foods and medications differently. After 70, the liver and kidneys don't function as efficiently as they once did, making it harder to metabolize and clear certain substances from the bloodstream. Additionally, most seniors take multiple medications to manage chronic conditions, and grapefruit can interfere with over 85 different prescription drugs. What makes this situation particularly alarming is that many people, including some healthcare providers, remain unaware of just how serious these interactions can be. Even more concerning, the effects aren't immediate. Grapefruit can alter drug metabolism for up to 72 hours after consumption, creating a delayed reaction that makes it difficult to identify the cause. The consequences of this seemingly innocent fruit range from medication failure, where your prescriptions don't work properly, to dangerous toxicity, where levels of medication build up to harmful concentrations in your bloodstream. For seniors already managing multiple health conditions, these interactions can trigger severe complications or even prove fatal in some cases. But here's what might surprise you: you don't have to eat large amounts to experience these effects. Even a small glass of grapefruit juice or half a fresh grapefruit can be enough to trigger dangerous interactions in sensitive individuals. And unlike some food-drug interactions that diminish over time, the body doesn't adapt to grapefruit. Each exposure creates the same risk. If there's one message to take from this section, it's that what's healthy for one age group can be harmful for another. Your body at 70 plus requires different considerations, and being aware of these age-specific risks could literally save your life. Now, let's examine the 5 most serious complications that can result from consuming grapefruit after 70. Complication No. 1. Dangerous blood pressure fluctuations. Among the most serious risks of consuming grapefruit after 70 is its profound effect on blood pressure medications, a concern that affects millions of seniors who rely on these drugs daily. What makes this interaction particularly dangerous is how silently and powerfully it occurs. When you consume grapefruit while taking certain blood pressure medications like calcium channel blockers, including amlodipine, nifedipine, or felodipine, the fruit prevents your intestines and liver from breaking down these drugs normally. This doesn't just slightly alter the medication's effectiveness, it can increase the concentration in your bloodstream by 200% or more. Imagine taking what should be a precisely calibrated dose of medication, only to have your body absorb the equivalent of 2 or 3 times that amount. The results can be dramatic and dangerous: sudden drops in blood pressure that can cause dizziness, falls, or even loss of consciousness. For seniors, a fall resulting from this type of interaction isn't just a minor accident, it can lead to fractures, head injuries, or worse. What's truly alarming is how unpredictable this interaction can be. Some people experience severe symptoms after consuming just a small amount of grapefruit, while others might not notice immediate effects. This unpredictability leads many seniors to continue consuming grapefruit, unaware that it's creating a serious medical risk. The challenge is that as we age, Our cardiovascular system becomes less adaptable. After 70, your body has a harder time compensating for sudden blood pressure changes. Your blood vessels have lost some elasticity, and your heart can't adjust its output as quickly as it once could. This means that medication interactions that might cause only minor symptoms in younger adults can create dangerous situations for seniors. One frequently overlooked issue is that these interactions aren't limited to fresh grapefruit. Grapefruit juice, even when packaged as 100% pure, actually contains more concentrated compounds than the whole fruit. Many seniors drink grapefruit juice believing it's a healthy choice, not realizing it's amplifying their medication to potentially dangerous levels. Another common misconception is that separating your medication and grapefruit consumption by a few hours solves the problem. Unfortunately, the compounds in grapefruit can affect drug metabolism for up to 3 days after eating it. Taking your blood pressure medication in the morning and having grapefruit with dinner still creates significant risk. Avoiding this dangerous interaction isn't just about preventing immediate symptoms. It's about ensuring your blood pressure remains properly controlled for the long term. Consistent blood pressure management is essential for preventing heart attacks, strokes, and kidney damage. When grapefruit interferes with this delicate balance, it puts your entire cardiovascular system at risk. Speaking with your doctor about all your medications and potential food interactions could literally save your life. If you're still watching and finding this information helpful, type blood pressure in the comments so I know you're here. And if you haven't subscribed yet, hit the subscribe button and turn on notifications so you never miss valuable tips like these. Your support helps us keep making content that empowers and educates. Let's continue with the second major complication. Complication No. 2. Statin medication toxicity. One of the most widely prescribed medications for adults over 70 is statins, drugs that help lower cholesterol and reduce the risk of heart disease and stroke. Millions of seniors take these medications daily, including popular brands like Lipitor, atorvastatin, Zocor, simvastatin, and Pravastatin. What many don't realize is that grapefruit creates one of the most dangerous interactions with these life-saving medications. When you consume grapefruit while taking certain statins, the fruit blocks an enzyme in your intestinal wall called CYP3A4, which normally breaks down the medication, controlling how much enters your bloodstream. Without this enzyme working properly, statin levels can rise dramatically, sometimes increasing by 300% or more. Your body essentially receives an overdose of the medication. Even though you've taken exactly the dose prescribed by your doctor, the consequences of this interaction can be severe and sometimes permanent. The most serious complication is a condition called rhabdomyolysis, a breakdown of muscle tissue that releases proteins into the bloodstream. This can cause intense muscle pain, weakness, and in severe cases, kidney failure. What starts as seemingly minor muscle aches can quickly escalate into a medical emergency requiring hospitalization. Many seniors dismiss early warning signs like muscle soreness or weakness, attributing them to normal aging or overexertion. By the time more serious symptoms develop, like dark, cola-colored urine, indicating kidney problems, significant damage may have already occurred. What makes this interaction particularly troublesome is that seniors often don't connect their symptoms to grapefruit consumption. The effects aren't immediate, they build up over days as the medication accumulates in the system. A person might eat grapefruit on Monday but not experience muscle pain until Wednesday or Thursday, making it difficult to identify the true cause. Another often overlooked aspect is that different statins have different levels of interaction. While some statins like fluvastatin and rosuvastatin have minimal interaction with grapefruit, others like simvastatin can see concentration increases of up to 330%, more than triple the intended dose. Many patients aren't informed about these differences when their medications are prescribed. The tragedy is that this risk is entirely preventable. Alternative fruits provide similar nutritional benefits without dangerous medication interactions. Simple substitutions, choosing an orange instead of grapefruit, for example, can eliminate this risk while still providing vitamin C and other nutrients. For those taking statins, completely avoiding grapefruit and its juice is the safest approach. Even small amounts, like the grapefruit in a fruit salad or the splash of juice in a cocktail, can trigger these interactions. And contrary to what some believe, organic or freshly squeezed grapefruit juice is just as risky as store-bought varieties. If you're currently taking statins and have been consuming grapefruit, don't panic, but do take action. Speak with your healthcare provider about your medication regimen and whether you should be tested for any adverse effects. They might recommend switching to a different statin with less interaction potential, adjusting your dosage, or simply helping you find safe fruit alternatives to enjoy. Complication No. 3. Heart rhythm disruptions. Beyond blood pressure and cholesterol medications, grapefruit poses another serious cardiac risk for adults over 70, potentially life-threatening heart rhythm disturbances. This complication occurs when grapefruit interacts with certain heart medications, including antiarrhythmics and some antibiotics commonly prescribed to seniors. Heart rhythm medications like amiodarone, dronedarone, and quinidine are precisely calibrated to help maintain a stable heartbeat. When combined with grapefruit, the concentration of these drugs can increase dramatically, sometimes reaching toxic levels that actually cause the very arrhythmias they're meant to prevent. This creates a particularly dangerous situation for seniors, whose hearts are already more vulnerable to rhythm disturbances. After 70, the heart's electrical system naturally becomes less reliable. The specialized cells that control your heartbeat don't function as efficiently, and the heart muscle itself undergoes changes that make rhythm problems more likely. What makes this interaction especially frightening is how quickly it can become life-threatening. Severe heart rhythm disruptions can cause palpitations, dizziness, fainting, or even cardiac arrest in extreme cases. For seniors living alone, these symptoms can be especially dangerous if help isn't immediately available. One particularly serious condition that can result from this interaction is something called torsades de pointes, a specific type of ventricular tachycardia that can lead to sudden cardiac death. This rhythm disturbance often occurs with little warning and requires immediate medical intervention. Even antibiotics like clarithromycin and erythromycin, commonly prescribed for respiratory infections in seniors, can interact with grapefruit to affect heart rhythm. Many patients don't realize that the fruit juice they're drinking to boost their vitamin C while fighting an infection is actually creating a dangerous drug interaction. Another overlooked danger comes from supplements containing grapefruit extract or similar citrus compounds. Many seniors take these products for weight management or immune support, not realizing they carry the same risks as the whole fruit. Always check supplement labels carefully, and when in doubt, ask your pharmacist. The time frame for these interactions is also important to understand. While some medication interactions happen immediately, grapefruit can continue affecting drug metabolism for up to 72 hours after consumption. This means having grapefruit at breakfast on Monday could still affect a heart medication taken on Wednesday. For seniors managing heart conditions, the safest approach is complete avoidance of grapefruit and similar citrus fruits like Seville oranges and pomelos. Even small amounts can trigger interactions, and there's no way to predict how severe your individual reaction might be. If you're currently taking heart medications and have been consuming grapefruit, speak with your cardiologist immediately. They may want to monitor your heart rhythm or adjust your medications accordingly. Remember, it's always better to be cautious when it comes to your heart health. If you're still watching and found this part useful, type "heart health" in the comments to let me know you're here. And if you haven't subscribed yet, make sure to hit that button and turn on notifications so you never miss a new video. Your support helps us continue creating content that educates and empowers. Complication No. 4. Compromised immunity and increased infection risk. The fourth serious complication affects thousands of seniors taking immunosuppressant medications, drugs that prevent organ rejection after transplants or manage autoimmune conditions like rheumatoid arthritis, lupus, or inflammatory bowel disease. Medications such as cyclosporin, tacrolimus, and sirolimus are life-sustaining for many seniors. These powerful drugs require extremely precise dosing. Too little, and you risk organ rejection or disease flare-ups. Too much, and you suppress the immune system excessively, opening the door to dangerous infections. When grapefruit enters the picture, it dramatically increases the concentration of these medications in the bloodstream, sometimes by 400% or more. This massive increase essentially creates an overdose situation with potentially life-threatening consequences. The primary danger is severe immunosuppression, which leaves seniors vulnerable to infections their bodies would normally fight off easily. Common colds can progress to pneumonia. Minor cuts might develop serious infections, and opportunistic pathogens that wouldn't normally cause disease can become dangerous threats. For transplant recipients, this interaction is particularly concerning. These patients walk a delicate line between preventing rejection and maintaining sufficient immunity. Grapefruit can push them too far in the wrong direction, creating an unnecessarily high risk of serious infections. What makes this interaction particularly insidious is that the immunosuppressive effects compound over time. Each exposure to grapefruit while on these medications further weakens the immune response, creating a cumulative effect that becomes increasingly dangerous. Another overlooked aspect of this interaction is that it affects not just oral medications but also some topical immunosuppressants used for conditions like eczema and psoriasis. The compounds in grapefruit can be absorbed through the skin when eating the fruit, increasing the medication's effects. For seniors already dealing with age-related immune decline, this additional suppression can be the factor that tips the balance towards serious illness. After 70, the immune system naturally becomes less responsive to new threats and less efficient at fighting infections. Adding medication interactions to this equation can create significant health risks. Many healthcare providers don't specifically warn patients about this interaction, assuming it's common knowledge or focusing on other aspects of medication management. As a result, many seniors continue consuming grapefruit without realizing they're compromising their treatment and putting themselves at risk. If you or someone you care about is taking immunosuppressant medications, eliminating grapefruit entirely is essential. This includes obvious sources like fresh fruit and juice, but also hidden sources like certain sodas, cocktails, and marmalades that may contain grapefruit as an ingredient. Complication No. 5. Mental health medication imbalances. Our fifth complication focuses on how grapefruit affects psychiatric medications commonly prescribed to seniors, a dangerous interaction that can lead to either treatment failure or toxicity, with serious consequences for mental well-being. Many adults over 70 take medications for conditions like depression, anxiety, or insomnia. These include common drugs like buspirone, sertraline, quetiapine, and diazepam. The effectiveness of these medications depends on maintaining stable levels in the bloodstream, not too high, not too low. When grapefruit enters the picture, it disrupts this delicate balance. For some psychiatric medications, grapefruit dramatically increases blood levels, potentially causing severe side effects like extreme drowsiness, confusion, or respiratory depression. For others, it can reduce effectiveness, leading to breakthrough symptoms like anxiety attacks or depressive episodes. What makes this particularly dangerous for seniors is that symptoms are often misinterpreted. Confusion or behavioral changes might be attributed to dementia rather than medication toxicity. Increased anxiety or depression might be seen as worsening mental health rather than a treatment interference. One frequently overlooked danger involves sleep medications. Many seniors take medications like zolpidem, Ambien, or esopicolone, Lunesta, to help with insomnia. When combined with grapefruit, these medications can reach dangerous levels, increasing the risk of nighttime falls, excessive sedation, or even respiratory problems. Another serious concern involves mood stabilizers and antipsychotic medications. These drugs require careful dosing to balance symptom control with side effects. Grapefruit can push this balance toward toxicity, potentially causing dangerous neurological reactions like tardive dyskinesia, involuntary movements, or extreme sedation. The timing of this interaction creates additional complications. Many people take psychiatric medications in the evening or before bed, and might have grapefruit with breakfast the next morning, not realizing they're creating a potentially dangerous situation as the fruit's compounds affect how their body processes the next dose of medication. For family members and caregivers, being aware of this interaction is especially important. Seniors with memory challenges may not remember dietary restrictions, making it essential for those supporting them to understand these risks. Social situations can also create unexpected exposure to grapefruit. Seniors attending brunches, community meals, or staying in care facilities may be served grapefruit or its juice without realizing the potential dangers. Having a clear understanding of these risks helps everyone make safer choices. If you or someone you care for takes psychiatric medications, complete avoidance of grapefruit is the safest approach. Speak with your healthcare provider about possible alternatives if you've been enjoying grapefruit regularly. There are many other fruits that provide similar nutritional benefits without these dangerous interactions. Safe alternatives and practical solutions. Now that we understand the 5 major complications grapefruit can cause after age 70, let's focus on practical solutions and safe alternatives that still provide the nutritional benefits without the risks. First, let's talk about replacing grapefruit with safer citrus options. Regular oranges, tangerines, and mandarins provide excellent vitamin C and flavor without the dangerous compounds found in grapefruit. These fruits don't contain the specific furanocoumarins that interfere with medication metabolism, making them safe alternatives for most seniors. If you enjoy the tartness of grapefruit, consider trying pomegranate instead. It offers a similar sweet tart flavor profile along with powerful antioxidants that support heart and brain health. Unlike grapefruit, pomegranate doesn't interfere with the CYP3A4 enzyme system in your body. For those who rely on grapefruit as part of their weight management routine, berries make an excellent substitute. Strawberries, blueberries, and raspberries are low in calories, high in fiber, and packed with antioxidants. They help create the same feeling of fullness without the dangerous medication interactions. Another practical tip is to become a label reader, not just for medications, but for foods as well. Grapefruit can hide in unexpected places like fruit juices, smoothies, flavored waters, and even some desserts and cocktails. When dining out, always ask about ingredients, especially in breakfast dishes and drinks that might contain citrus. If you're currently taking medications, the safest approach is to consult your pharmacist or doctor about potential grapefruit interactions. Bring a complete list of all your medications, including over-the-counter drugs and supplements, and ask specifically about grapefruit and other food interactions. For some medications, Your doctor may be able to prescribe alternatives that don't interact with grapefruit. This is particularly important if you've been eating grapefruit regularly for years and it's an important part of your diet or cultural food traditions. Another practical solution is to use technology to help manage medication safety. Several smartphone apps can alert you to potential food-drug interactions based on your medication list. These tools can be especially helpful for seniors managing multiple prescriptions or for family members helping with medication management. Finally, don't underestimate the power of communication. Make sure all your healthcare providers know about all the medications you take, including those prescribed by other doctors. Sometimes specialists focus on their area of expertise without considering the full picture of your medication regimen. Conclusion: taking control of your health after 70. As we wrap up, take a moment to reflect on what we've discussed: how grapefruit, despite its reputation as a healthy food, can create serious health risks for adults over 70 who take common medications. The 5 major complications we've covered: